Assalamualaikum and very good day. My name is Awatif Auni binti Zamri. My student ID is 2023305-213 from RCDCS 3C. So today I would like to talk about ASD, Autism Spectrum Disorder. So let's watch this video.
This is the story of a boy who is very sensitive to lights and sounds. So he built secret hiding places where nothing could get in. The boy didn't like looking people in the eye. It made him feel uncomfortable. One day, he found out he had something called autism. His family got him help, and slowly, he learned how to live with it better.
Early intervention can make a lifetime of difference. Learn the signs at autismspeaks.org.
What is ASD? ASD, Autism Spectrum Disorder, is a developmental disability caused by differences in the brain. Some people with ASD have a known difference, such as genetic condition. Other causes are not yet known. Scientists believe that there are multiple causes of ASD that act together to change the most common ways people develop. We still have much to learn about these causes and how they impact people with ASD. People with ASD may behave, communicate, interact, and learn in ways that are different from most other people. There is often nothing about how they look that sets them apart from other people. The abilities of people with ASD can vary significantly. For example, some people with ASD may have advanced conversation skills, whereas others may be nonverbal. Some people with ASD need a lot of help in their daily life. Others can work and live with little of the support. ASD begins before the age of 3 years and can last throughout a person's life. Although symptoms may improve over time, some children show ASD symptoms within first 12 months of life. In others, symptoms may not show until 24 months of age of the later. Some people with ASD gain new skill and development milestone until around 18 to 24 months of age, and they gain a new skill of loss and once had. As children with ASD become adolescents and young adults, they may have difficulty developing and maintaining friendship, communicating with parents and adults, or understanding what behavior are expected in school or on the job. So, what are the signs and symptoms of ASD? People with ASD often have problems with social communication and interaction and restricted of repetitive behavior or interest. People with ASD may also have different ways of learning, moving, or paying attention. These characteristics can make life very challenging. It is important to note that some people without ASD might also have some of these symptoms. The earlier signs, which are issue with communication, shy does not respond their name, hysterics, preferred to play alone, sensitive to loud noises, tiptoeing, avoiding eye contact, ignoring the danger, delayed speech development, aversion to touching. Diagnosis. Diagnosing ASD can be difficult since there is no medical test like a blood test to diagnose the disorder. Doctors look at the child's behavior and development to make a diagnosis. ASD can sometimes be detected at 18 months of age or younger. By age 2, a diagnosis by an experienced professional can be considered reliable. However, many children do not receive a final diagnosis until they are much older. Some people are not diagnosed until they are adolescents or adults. This delay means that people with ASD might not get the early help they need. Next is risk factor. There is not just one cause of ASD. There are many different factors that have been identified that may make a child more likely to have ASD, including environmental, biology, and genetic factors. Although we know little about specific causes, the available evidence suggests that The following may put children at greater risk for developing ASD, such as having a sibling with ASD, having certain genetic or chromosomal condition such as Fragile X syndrome or tuberous sclerosis, experiencing complication at birth, being born to older parents. CDC is currently working on one of the largest US studies to date on ASD. This study, called the Study to Explore Early Development SEED, was designed to look at the risk factor and behavior related with ASD. CDC is now conducting a follow-up study of older children who were enrolled in SEED to determine the health, functioning, and needs of people with ASD and developmental disabilities as they mature. Lastly, treatment and intervention service. Current treatments for autism spectrum disorder (ASD) seek to reduce symptoms that interface with daily functioning and quality of life. ASD affects each person differently, meaning that people with ASD have unique strengths and challenges and different treatment needs. Therefore, treatment plans usually involve multiple professionals and set toward the individual. Treatments can be given in education, health, community, or home setting, or combination of settings. It is important that providers communicate with each other and the person with ASD and their families to ensure that treatment goals and progress are meeting expectations. As individuals with ASD exit from high school and grow into adulthood, additional service can help improve health and daily functioning and facilitate social and community engagement. For some, support to continue education, complete job training, find employment, and secure housing and transportation may be needed. So, there are types of treatments, which are behavioral, developmental, educational, social relational, pharmacological, psychological, complementary, and alternative. That's all from me. Thank you, cause give your ears listen about ASD. Bye bye.